Hi, I'm Mandy. I'm here to talk to you today about ovarian cancer. I lost my mother to ovarian cancer, and did you know that 7,000 people will be diagnosed each year, 4,000 of which will probably die of the disease. 5% of ovarian cancers are genetic, the rest are lifestyle, and I'm just here to tell you my story. I was diagnosed last year. Hi, my name's Andie. I've been an air traffic controller for 26 years. I'm a single mum to my 16-and-a-half-year-old son. Born in the north of England, but spent most of my time in Leicestershire. In September 2013, I was diagnosed with ovarian cancer. And this is my story.
Andie, thanks for coming in today. Really appreciate you sparing this time and coming to tell us about your cancer journey. We haven't actually had that many people with an ovarian cancer, so I'm really interested to know how things went for you, and also how did the diagnosis come about in the first place? So what was the first thing that happened to make you realise there was something wrong?
Well, if I look back on things over probably the beginning of sort of 2013, I guess my wee rate started to slow down a little bit. But those are the sort of things you don't really notice when you're busy and you're getting on with life. And it was only sort of probably around about July time, I suddenly thought, hang on, I used to wee a bit quicker than this. What's going on? Anyway, after that, I didn't think a great deal of it, if I'm honest. And it was only in September when I started getting a lot of pain in my tummy, and then my tummy started to swell up, and then a couple of days later I couldn't wee at all, that I realised I had a big problem. To start with, the GP thought it was a urinary tract infection, gave me some antibiotics. I went back a couple of days later, and obviously at that point he knew something was very wrong.
Yeah, he could see there was something pretty serious. So what did he do?
He then referred me to the urology triage at the Leicester General Hospital. I went along there and I was admitted that evening for lots of tests. That was a Friday, and by the Sunday I had my diagnosis after a CT scan and various other blood tests and things.
How do you think the diagnosis was handled in the way they told you?
The guy basically came to my bedside on Sunday morning and said, we feel there's a very high chance you have ovarian cancer, and we think it's spread to your bowel. At that point, obviously, I was shell-shocked, and he asked me if I had any questions. At that point, obviously, I didn't have any questions because I was just so empty inside. He said he'd come back in 20 minutes, but I never actually saw him again.
That sounds like an anomaly, to put it mildly, but did you get to talk to somebody else in the team?
I did, in the end. There was a very good doctor, actually, a junior doctor, who spared a lot of his time, and one of the Macmillan nurses came to speak to me. He was a palliative nurse, and of course the minute I saw his badge, I just panicked like hell, and he just said to me, well, don't worry, we've got options. I just want to talk to you about what happens next.
It's important, I think, that you feel like somebody's on your side, and they're also telling you that something can be done to help. And it sounds like there was at least one person at that early stage saying that. But did it feel like that to you? Did it feel like, you know, I can see a way through this? Or was it too early to say that?
I was blown away at the beginning. When he came to speak to me on the Sunday morning, I expected him to say something like, oh, you've just got a bit of wind, or something like that. Everything's going to be fine. But of course, the news was like a bombshell, because 18 years previously I'd lost my mum to ovarian cancer too, and she was age 53. At the time of my diagnosis I was 48. So yeah, a bombshell. I didn't really know how to feel. I think I had a few tears.
Yeah, I can understand that. As time went on, what kind of support was put in place to help you, if any, in fact?
Yeah, the Macmillan nurses were absolutely brilliant, the specialist nurses. They came to rescue me basically, and to explain a lot of the ins and outs, what was possibly going to happen. But obviously at this stage, it was all a possible, what is possibly going to happen, because I still had to go through a biopsy to absolutely confirm the diagnosis.
Was that the next step then?
That was the
You
next
had to have
step.
a definitive procedure.
Yes.
Yeah. What did they tell you after you had the biopsy? What about the outlook, the staging, you know, all those kind of technical things?
That's right. I had the biopsy. I think I waited a couple of weeks after that and then saw the oncologist for the first time. And he basically put it to me there and then. He said what he'd seen on the scan, what my sort of prognosis was looking like, the sort of things that he could do. And it was a bit of a shock. The whole thing was a bit of a shock. I was diagnosed at that stage as 3C, but it was later diagnosed as 4A.
And for the viewer, what can you say about what those numbers mean?
3C means advanced cancer. It means that the probability of long-term survival is actually very low. I did read some statistics, and I've also been told very similar things, that there's something like a 5.7% chance of you actually living beyond 3 or 5 years with that sort of stage of cancer.
So you already knew at a very early stage that things were difficult in terms of the staging and how things looked. Does that mean you were already thinking of your own mortality at that, you know, at that point?
I did think about it, just for a while though.
Yes.
Because, you know, suddenly something came over me and I thought, no, I'm going to fight this. I'm going to fight this like nothing on earth. I'd lost my mum to the disease and I was so positive. I just thought, no, I am going to beat this and I'm going to change my diet. I'm going to do everything that I possibly can to combat this bloody awful disease. Sorry, I shouldn't swear. But anyway, I did everything that I could. I remained positive. I hardly cried, and I just thought, no, I'm going to beat this. I'm going to beat the shit out of this.
Were you a very determined person before this, or was that a new?
I'm a bit of a gutsy one. Yes, if somebody says I can't do it, I'll do it anyway.
So in a way, you were faced with the ultimate challenge at that moment.
Absolutely.
And you would decide to fight back, I guess.
Yeah, definitely. Definitely, now, without a doubt.
Do you think it helps in terms of the cancer journey, the actual time spent, quality of life, to be somebody who's fighting back rather than somebody, well, I mean, every kind of psychological outlook's possible, but you could be more passive, for example, and just say, let's wait to see what happens.
Yes.
Do you think it actually helps with your day-to-day life to be that person who fights back?
At the point of initial diagnosis, I wasn't going to let fate sort of take over. I was in control and that was it. And I wasn't going to let it get to me at all. So I don't think you can give up. If you give up, I think really your chances are a lot lower of actually coming through the thing.
Okay. So an intriguing question here is, let's say you do want to fight back and you want to do everything you can to maximize your chances.
Yeah.
What can you actually do in reality? What is it that you can change?
Well, I read a book called Evolve Your Brain, and it was absolutely brilliant. It just got me so excited. It basically said that when you think really positive thoughts, your cells change, all the different chemical reactions in your body actually change. And it's almost like you're telling your body to get better. It's almost like you really can take control to try and sort of, heal yourself. I got really excited with that. I did a lot of transcendental meditation. I really went inside of myself. I pretended that I was a Pac-Man and I was eating all the cancer away and I was shoving it out of my body every single day. All these visualizations, all these positive thoughts. And I think that really did help, big style.
Does it help you regain a sense of control, in the sense that when you're going through a very difficult illness, a lot of things are done to you?
Yes.
A lot of appointments, a lot of investigations, and a lot of therapies where you're, to put it in an extreme form, you can feel almost like the victim of it.
Yeah.
But by doing what you're describing, it perhaps helps you take control back?
It definitely does. And I think once you have lost that control, you really might as well give up. And I think that was what really kept me going, big style. And all the time they were sticking needles in me, I was just trying to center myself, be really calm, and just smile. And actually people kept saying to me, "Why are you so happy?" I said, well, there's nothing I can do particularly about this, is there? I might as well decide to be happy rather than decide to be sad. I mean, this has been thrown at me. I might as well enjoy every single moment, really. And when you're sticking needles in me, then I'll just think of something else.
So just taking that in detail, can you be happy even in adversity?
Absolutely.
Could anyone, in theory, choose to have a different frame of mind, in your opinion?
Absolutely. There's no question about that whatsoever. I saw the most amazing thing the other day. I really did, and I have never seen anything like this in my life before. But I think when you've got something like this and you're suddenly taken out of your real busy day-to-day life, you have a little bit more time to just observe things. And I looked up, and at that moment there was a horse chestnut tree, and it really decided at that point to drop all its conkers everywhere. It was like conker rain, and I was absolutely, totally in awe of the whole thing. But it was like a miracle. It was like a miracle to me just to be able to be here and appreciate nature and just see how amazing the whole thing is, actually. But yeah, positivity is amazing. And you can even smile even though it's hurting so bad. I was even smiling when I was in intensive care.
No, it's quite remarkable. Do you think you can become a more astute observer of life, or even appreciate life more at this time?
Definitely.
Because I do notice that about you, that you do seem to have a sense of appreciation, which maybe others don't have.
Oh gosh, yes. I mean, everything is so precious around you, isn't it, really? Everything is so magical. And I think if you can just stop and actually see the magic around you, then that really helps. I'm also really into tuning into the universe and all the energy that is around you. And I felt like I've been surrounded by numerous angels since my illness, and that people have been extending their hands out and helping me to cope with it all.
Is it possible that this positive attitude could rub off on others, that other people might benefit from your outlook?
Lots of people have said that I've been a real inspiration through this, and I really hope so, I really do. But I saw the way my mother handled it, and she gave up, and I just didn't want to do that. There was too much to live for, and my son is so precious.
Let's talk about the next step, which was the beginning of treatment for you. I think that was chemotherapy.
Yes, it was, yes.
What do you remember about that chemotherapy? How did your body respond to it?
I didn't respond very well to the chemotherapy. It made me very, very sick. And all in all, I think throughout my entire treatment, I had something like 7 admissions into hospital, one of which was in intensive care. The chemotherapy that I had to start with was carboplatin, or carboplatin.
Yeah, carboplatin.
Carboplatin. And unfortunately, I got an infection and ended up with chest sepsis and ended up in intensive care. And then after that, I had a couple of sessions of carboplatin and paclitaxel together. And of course you've got the dreaded situation there of losing all your hair, and mine was long and curly and I had to have it all cut and all that kind of thing. And it was just, that was a bit tearful, I have to say. But I think you sort of really get upset and you really worry about that side of things. But in actual fact and in reality, it didn't turn out to be quite as bad as I dreaded deep down inside. There was a whole variety of wigs that itched like hell and I had to keep taking them off, dragging them off everywhere you went. But I wore a lot of little beanie hats and they were really cute. Lots of people in the village made me hats and things like that, and they were lovely. So I spent most of the winter time wearing these little hats.
You got used to the idea of not having the normal hair for you then quite quickly?
Yes, I did, yeah. But having said that, you still don't feel like you. All of a sudden, you feel like somebody else. And if you were to meet anybody new, you don't feel as if it's you. You feel as if you're putting forward some sort of image of somebody else, because obviously you've got a different wig on or a different hat on.
In a way, that change in your appearance is almost symbolic of something being wrong, and it invites others to look or ask a question, I guess.
It does, yes. And I think not very many people did that, actually. I was quite grateful for that, really. And I was very lucky because my chemotherapy actually took place during the winter time. So I could actually disguise my hair loss quite a lot using these wigs and hats. And it had grown back by around about May time, just as the weather started getting better. So I could enjoy the summer with a little bit of hair.
What was the reaction of friends, family, or just people in the street?
People in the street, not so much, because I'd cover my head up.
They didn't notice so much.
And not really, but I think my sister was really taken aback to start with. I mean, and I was as well. It seems ever so funny looking at yourself in the mirror with no hair. It's sort of a bit of a shock. But like I said, you do get used to it. Having said that, I'm not looking forward to going through that situation again. I really don't want to go through it again. Having been there once, you don't really want to do it again.
Well, let's come up to date a little bit. So you had the chemotherapy. What was the next step?
Then I had interval debulking surgery and basically a hysterectomy, and they took my omentum as well, which is the fatty apron just here. I think I had a number of tumours scattered around, and they took those out as well.
How successful did they feel the surgery was?
It was very successful. It was very good, yes.
And did your body recover fairly promptly from the surgery?
I found it very difficult because about 3 weeks after the surgery, they gave me some more chemotherapy. And at that point, I can honestly say I thought I was going to die. I felt so unwell. It was untrue.
That session or cycle of chemotherapy was the worst, was it?
It was, definitely.
And was it due to the combination of the surgery and the chemotherapy?
I think so. My body just didn't feel strong enough. And I did have a lot of complications through my chemotherapy in that my bloods weren't recovering quickly enough either. My immune system was really suppressed and I wasn't really recovering as quickly as I should have been, hence the number of admissions into hospital. It made me very, very sick as well.
But that wasn't the end of the process for you. What happened after that?
After the chemotherapy?
The second bout, yeah.
The second bout. I had some more chemotherapy after that as well.
So you've had more than your fair share of applications of chemotherapy?
Yeah. I've had basically 2 cycles of chemotherapy and 1 major operation.
Yeah. After all that was done, were you told that you got an element of stability in terms of your cancer? Did the cancer go into remission at all?
Not at that stage. I didn't find out. Well, I didn't have a scan until the 15th of May, and I got the results from the scan on the 2nd of June, which was my birthday.
And what were the results?
It was that they couldn't see any cancer on the scan.
So things had gone well at that stage? They'd
gone really well. And when I was in the oncologist's office, he told me, but there was something wrong. I was with my best friend and she said, "Why are you in such a bad mood?" And I just said to her, "It hasn't gone." I just knew.
You felt it happened?
Yeah.
You were sensitive to your own body in a way?
I think there was something telling me that how could all that possibly have gone? How can they be so sure that it is all gone? For some reason, I just did not believe him, even though there was absolutely no evidence on the scan whatsoever.
So they couldn't see anything, so at face value, the treatments had been successful.
Yeah.
and you were told that things were clear and probably sent away into a monitoring phase.
Yes,
where
that's
you
correct.
were just seen, maybe not as regularly, but for checkups.
Yeah. They told me to come back on the 4th of September for my 3-month checkup.
And with ovarian cancer, isn't it the case they can measure the blood level of a particular marker, CA125?
That's correct, yes.
And so they've got a way of testing you without being too invasive, if you like.
Yes, that's right. So on the 4th of September, they did a CA125 blood test. And 2 weeks later, I got the results, and it was over 100, and it was just over 100, I think, at that point. I think the normal value is around about 35. So they could see that it was rising again. Yeah.
So there was a slight warning flag at that point.
There was, yes. At that point, they sent me for another scan, and 2 weeks later, after that again, it revealed a couple of tumours.
And when was that? When are we talking about?
The scan was on the 15th, or somewhere around that time of September. I found out at the end of September that I had 2 more tumours.
And we're talking about just about a month ago, just over.
Yeah, that's correct.
Yeah. So you had actually this disturbing news that it had come back. What was your reaction emotionally at that time?
For the first time, really, I actually was really upset. I did actually burst into tears at that point. It wasn't a stunned silence like it was the first time. It was almost like, okay, here we go. This isn't good. And of course, when it starts coming back, you think, perhaps the doctors were right. Perhaps I really don't have any control of this thing, and perhaps it is really all down to fate. So of course I went into this phase for about 2 to 3 days, and I thought, okay, I better start planning things. And actually, I've done an awful lot of work since then, planning things, just in case. Because I think at that point, I really had to face the truth of it. I'd lost my mum of the disease, the statistics weren't great, and to be honest, it's just come back. And it's come back very quickly. So I guess that was difficult.
So you almost went into a new phase, both physically and psychologically.
Yeah.
But you were planning for the future now, and that future may have been a future where you weren't around.
That's correct.
And a lot of people would be uncomfortable talking about this, but I've noted, from talking to you a few times, that you quite matter of fact, you don't mind saying how things are in a way.
Absolutely. I mean, I was horrified to start with. I did speak to a doctor at Loros last year, and he sort of helped me put it all in perspective. He actually said, everybody's got to die. And suddenly I didn't feel alone anymore. It was almost like, oh gosh, of course, how could I not think of that? Of course everybody's got to die, but he says you may just have to face it a little bit sooner than you anticipated. So I'd get out there and do all the stuff that you really want to do, which is easier said than done when you can't get insurance. But anyway, I think I just gave it a lot of thought, and now I'm positive again. If it happens, it happens. I've done all the things that I need to do to put everything in place, but I'm still going to fight it.
So in a way, you have made some plans in case a bad eventuality happens.
Yeah.
But you're still carrying on with life the best you can anyway.
Well, I had long conversations with my son, and he said, Mum, why are you not so positive just now? I said, well, only because we've really got to talk about the real nitty-gritty here together. And I've really got to put some things in place for you if the worst does happen. But I said, this is just a very small phase. And the other day I said to him again, come on mate, we're going to fight this now. I've sorted all that out. You're safe, you're going to be secure. Let's fight it from now on. And we went, yay! So I think, to be fair, that's what we're going to do again. And if it happens, we both know deep down that that is a very real possibility. But I think in the meantime, we're just going to do our best again.
I'm inspired to hear that. I want to ask you just one difficult question, if you don't mind me asking it, which is, what plans do you think it is rational to put in place if a viewer of this was in a similar situation where they were planning for their disease progressing? It might not, let's say it did, What kind of things are sensible to look at?
I think it's really important to speak to a lot of the adults that are actually quite close to your son or daughter, to make sure there are phone numbers exchanged so that people are aware who's there and who isn't going to be there if it does happen. A lot of my friends have said, you know, I'll be there if they need me, kind of thing. There are certain people my son would talk to and others that he just wouldn't, and you just know. So you sort of make sort of informal arrangements, I guess, with those people that you know he's going to talk to, and just come up with just a little plan. So they're aware. Also, obviously, you need to change your will and make sure you have written instructions aside from your will to just make sure that everything goes reasonably smoothly in the event. You've got to think about your funeral as well. I know that sounds daft, but you do. You know, what would you really like? You know, what would make you really happy if they did this or whatever? So those are considerations you have to think about as well. And just put as many things for your child security in place as possible, I think.
It's this kind of time when you appreciate the kind of support you have around as well?
Oh, absolutely. I'm so lucky. I've had so many friends seeing me through, and they're just all amazing. And I just, wow, they're great.
Do you think that they have a role in supporting your family as well? I mean, there's the family support, but then there's the extended support.
Yes.
You know, in a way, those layers can be helpful.
Absolutely. Well, they've all been brilliant in their own way. I mean, my best friend has been absolutely incredible. Every time that I've had chemo, really bad chemo, she's been there for me, cooking and things like that, come stay with me. I've had other friends who have come and helped Chris out or done a few little jobs while I've been in hospital and things like that. And I've had friends to talk to, and I have a friend who's also had breast cancer, and she's been a real support. She's been through very similar things herself, although her prognosis is a little better than mine. But I think things like that are really important. And it's really important to tell people who you really care about that you really love them as well.
And that can be a dilemma, whether to be honest and upfront. Because you can naturally wonder how people are going to react when you tell them.
Yes.
Not just a diagnosis, but a complication or a recurrence, you know.
Yes.
It's not easy to necessarily tell people, is it?
It's not. It's very difficult sometimes, but to be honest, I think you have got to say how it is. I think my father kept it a little bit from us, how it was with my mum, and we really got to know a little bit too late. So I think they might as well carry on in the journey with you. And that's hard for my dad because he's been through it before. I really can feel how he feels about that.
I'm interested in your view on the attitude of society to cancer, but particularly ovarian cancer. I mean, I guess ovarian cancer is one of those that's not as well recognised and known in the population. Do you think we should be giving more attention to this area?
Now, that is one thing I am actually quite angry about, if I'm honest. And I really do feel quite strongly about this. When my mother died of ovarian cancer, my sister and myself, we were living down in London at the time. Oh, well, we weren't, but we had been. And we had a link, I think, with one of the hospitals down there. And they were giving us a sort of screening of sorts. And then apparently, because the money ran out, they stopped doing it. And then a regulation came in that you had to have 2 people die or have ovarian cancer in the family before you were allowed any form of screening whatsoever. Which is horrendous, to be fair. Also, when I moved up to Leicestershire, I did mention several times to my GP surgery that my mother had died of ovarian cancer and could I have regular tests. One of the doctors listened to me and sent me a couple of times, but that was about it.
So you really didn't get access to any kind of regular screening procedure?
Not in the slightest. I was denied that because obviously there hadn't been 2 people in the family, just the one. So it took me and my diagnosis to actually, you know, make my sister sort of be eligible for screening and also for the genetic test once they discovered I was BRCA1.
Because there's an interesting angle to this, you just mentioned it there. There's a link between breast, prostate and ovarian cancer in the BRCA1 and or other genes which have been discovered. May mean there's an inherited component both in males and females. Has that been an issue for you?
Yes, absolutely. Obviously, when I went to see the genetic team, they traced it back through my mother's side. So obviously my mother's father obviously had the gene, then it was passed to my mother, then it was passed to my sister and myself. And because there's a 50% chance of it actually being passed to the next generation, there's obviously a 50% chance of my son having the mutated gene and also my two nieces as well. So it has a lot of implications. Obviously, once you carry the BRCA1 gene as well, you're actually born with an 85% chance of breast cancer and something like a 50 to 60% chance of ovarian cancer throughout your life. So it also raises the question, you know, what happens here? And we've both been advised to have double mastectomies as well, which is a bit of a nightmare. So it's an Angelina Jolie situation. Only unfortunately, I had to get the cancer before I actually found out that I was BRCA1 mutated.
So this is another angle that's opened up in terms of awareness and also screening, that it's not just for the current illness, you can actually screen for a risk factor.
Absolutely, that's right, yes.
And you think this would be worthwhile adopting in the way we
oh, absolutely. Operate? I'm probably talking rubbish from a doctor's point of view, but the way I've observed it, perhaps there might be a possibility of GPs just checking that CA125 once every 6 to 12 months of anybody whose mother has died or sister has died of ovarian cancer or has ovarian cancer. Might just be worth it.
I can see the logic in that.
Yeah. But I don't know, obviously from a scientific point of view, I don't know where we stand with that. But if it's all down to money, I'd be very, very angry.
What kind of help and resources have you accessed along the way that you've found helpful, and maybe things that are worth other people knowing about?
Cancer awareness, the ovarian cancer awareness, target ovarian cancer, the Macmillan sites, the NHS sites, they're all really good sites to visit, but try not to go onto the more unofficial sites. If you stick with the official sites, you can usually find out pretty much everything you need to know about all the treatment that you're going to get and that kind of thing. You can also get access to information on trials and that kind of thing.
Is there a danger of getting misinformation online?
I think there is. You've got to be careful which sites you visit, definitely. But I think you can certainly take some advice. People like Target Ovarian Cancer are absolutely brilliant, and they're probably the people to approach on initial diagnosis. They produce a pack that you can have a read through, and then you can become one of their voices and that kind of thing. So that helps other people too.
How much did you get involved in the online community, either chat rooms or
chat rooms at all? I'm not into that kind of thing at all. I just spoke to people face to face and just got my general information from there, so that I sort of knew what to expect when I went to see the oncologist and the surgeon.
Did you ever meet any other patients with a similar condition, just going about your travels in and out of hospital so many times?
Yes, I made some good friends.
And what were they a source of support? Do you stay in touch? Or?
Yes, we do. Yes. I met somebody with a similar diagnosis whose cancer has also come back, but she's great, and we're both fighters. We're not going to give up.
Any other source of support that you'd recommend? I'm thinking out loud now.
Yes.
Complementary treatments, group therapy.
Oh, absolutely.
Other source of information.
Reflexology. There's not a lot you can do, like massage and that sort of thing, but reflexology, that kind of thing, and just try and sort of take advantage of all the things that are available to you, some of the free complementary treatments that really do calm you down and make you feel loved, and that they really do make you feel good. And obviously that gives you more strength to fight the illnesses. Obviously psycho-oncology and being able to just chat to other people about, how you feel about things,
Did you feel that there's enough emotional support offered and around?
Yes.
I mean, I know it varies
Definitely.
from centre to centre,
Yeah.
but I'm just
Yeah.
curious as to whether you think that angle, the emotional side, is
Yeah.
adequately attended to.
Yeah, definitely.
For you, it was.
Yes, it was for me.
Yeah.
Yeah, definitely.
Did you have any ups or downs? I mean, you've talked about some. But
The only real down that I had, to be honest, I was petrified the night before the operation. I'd made this stupid mistake of going online and looking at the actual operation or something very similar online, and it frightened me to death.
Really?
And to be fair, there's a good job my best friend was with me, but I was petrified. And when she came with me on the day, we both looked at each other as I went wandering off with my pillow in my hand, and we burst out into tears, both of us. We weren't sure whether we would ever see each other again, but that was silly because we were in amazing hands, and my surgeon, Miss Moss, was absolutely incredible.
Well, that's good to hear. That's really good to hear. How have you found the longer term follow-up care in terms of who's around for you, how accessible they are, how much provision of care is given, once you're back in the community and trying to survive more on your own, I guess?
That was difficult. For those couple or 3 months or whatever.
Yeah.
It was almost like, okay, your cancer's gone now, come and see us in 3 months. Well, hang on a second, where do I really go from here now? Where do I really go from here? Especially knowing deep down that it hadn't. I found that quite difficult. But then after a couple of days of thinking about things, I just got out there and tried to appreciate everything around me again. And I think, enjoy every second. That is the important thing. Just enjoy the now, the here and now, every single second as it happens. Because what's the point in thinking about? And a lot of people said to me, well, anybody could be killed in a car accident tomorrow. You just don't know. Just enjoy the present. Don't even think about what. Once you've put everything in place, then you can just go and enjoy.
I heard you say at the beginning about your role at work, and I know you had a very interesting and responsible job.
Yes.
If I'm not mistaken, air traffic controller.
That's correct. Yes.
It's one of these things that small children fantasize about, controlling all the traffic.
Yes.
I'm sure there's a lot more to it than we know.
Yes.
What was the situation at work for you, just in brief?
It was very difficult because obviously once I was given the information that I had cancer, my entire life basically was taken from underneath me. Air traffic controllers have licenses, and the medicals that are attached to their licenses are very stringent. And basically, on hearing that news, I lost the medical that was connected to my license, which meant that I could no longer control my lovely aeroplanes.
So you had to step down in a way, on grounds of ill health.
That's correct, yes.
And were you hoping to go back? I mean, I guess at the
Yes.
back of your mind you were.
Absolutely.
But if I am not mistaken, you haven't been able to so far.
No, not at all. The people who decide whether or not you're fit enough to be an air traffic controller, it's the Civil Aviation Authority Safety Regulation Group, and it's the medical branch of that, and they decide whether or not your condition means that you can carry the medical or not.
Yeah.
And in my particular case, because my prognosis is so bad, they basically said, we can't give you your license back. In the event that I was cancer-free without any recurrence and without any sort of other interventions, such as chemotherapy or surgery, sometime in the future they may consider giving it me back, but that would be based on all sorts of different medical evidence.
I understand. So that was, I'm sure, a disappointment for you.
Absolutely, I was gutted. Like I said, my entire life, just my health, my job, everything was just taken from underneath me, and I was quite scared.
It's a lot to take on board at one time.
Yeah.
There's also a financial implication, isn't there?
Absolutely. The company have been fairly good to me, and we had a system in place for loss of licence insurance in the event that you did become unwell.
Okay.
And we're sorting that out at the moment.
All right. Now, but one thing regarding work is not just the actual work, it's the role that you have. In other words,
Yes.
you're doing something productive that you enjoy, and there's a routine, there's something to get up for.
Yes.
And if you go from that to just coming in for hospital appointments,
Yes.
it's a very severe change.
Absolutely.
But have you been able to get back a role, something that you found meaningful in life?
Well, up until about 2 or 3 months ago, if I'm honest, it took me all my time to just live, just to make a meal. Sometimes I couldn't even do that because I was so weak, or being sick loads of times a day. So until very recently, I've not been able to do an awful lot.
Yeah.
Over the summer period, I got out a little bit with my family and things, and then of late I discovered that I was not too bad at making jewellery. So I've been trying to concentrate on that and being a little bit creative, because at least that's something you can do even if you're in bed, having had chemotherapy, you know, in between throwing up.
Okay.
Yeah.
And I hear those bracelets are in demand.
Yes, I believe so. There's somebody in cancer research who thinks they might go down well next year in their next campaign, cancer research.
Yeah, that's wonderful to hear. You've also told me, I think, that you spent a lot of time with your family, with your sister, for example.
Yes.
And was that kind of a newfound warmth or relationship?
Yes, absolutely. We've grown apart a little bit. I mean, we've always been really close, but we have definitely got closer since the diagnosis, and we've seen a lot more of each other too. I think the reason why we drifted apart a little bit is because of responsibilities of just bringing up my nieces and my son. And obviously, you know, you're out sort of taking them swimming and doing all that kind of thing. Sometimes you just don't seem to have the chance to meet up, but certainly we've done an awful lot of that recently.
How do you see the situation right now for yourself, and how are you managing overall?
I'm okay, I'm not managing too badly. Definitely getting there, making plans, very optimistic about everything. I'm very lucky in that I do have a supportive employer.
Yes.
And you know, I do feel for people who are not in the same situation that I was in. I'm glad I planned for the future rather than going on fancy holidays and things like that. I'm glad I built up a little bit of security as well. I'm very, very grateful for that now.
Well, Andie, it's brilliant that you've been able to share this time with us and come in. I personally think you've given one of the most inspirational stories I've heard, because you are honest about your situation. You know that it's a cancer that's come back and you are facing the implications of that, but you didn't let that dominate your life. You're actually still maintaining your quality of life, and you're trying to appreciate even small things to make the most of life, and we should all be doing that in a way. So
I think that everybody should have a bucket list. And you know what, everybody should have a bucket list before they get ill, because what happens is you write your bucket list and then you're too ill, or you can't get the insurance to do the things on the bucket list, and that's the problem. So get one written straight away. My advice to everybody.
I'll take that on board. We'll get back to them straight away. Thanks for coming in today. All the best for the future.
Thank you.
Thanks a lot.
Thank you.